Okay, so for those of you who registered for the REALD training, REALD stands for Race, Ethnicity, Language, and Disability. You are at the right place. So hopefully you logged into the right training. And again, this is being presented by the OHA DHS Teams Community Partner Outreach Program in partnership with the Office of Equity and Inclusion. I will go ahead and get us through hopefully the REALD training portion of today, and then I have my colleague here today, Jessica Diaz, who will jump in after our break, and she will go ahead and cover our Renewals module. So the goals for today, or objectives for today, really have to do with our REALD standards. And what this means is we want to ensure that we communicate with our community partners about the value and the big picture of REALD. So we'll definitely cover that. We also want to make sure that we talk through all the updated questions and what they look like in the One system. So what they look like and how to ask these questions. And next, we'll talk about how to address follow-up questions and concerns, because we know your hearing concerns will definitely touch on how to best address those follow-up questions you're getting. All right, so starting with value and the big picture. Why is this really so critical? So first off, I have to say, the entire team here at DHS, CPOP, wow, I'm still getting used to that, and OEI, we are so thankful for your roles in Application Assister. We know that you've been really patient in waiting for more information, and really, you are the front face and on the front lines of meeting with clients. So we do have to remind all of you how important it is to ask these questions, and also help answer questions. But number one, we just want to say thank you for continuing to address these questions with OHP applicants and members. I think it's really important that we acknowledge it took us a while to get information out to you. So, thank you so much for serving as our frontline data collectors. So the top three questions we're going to talk about here really have to do with racial, ethnic identity. So we're going to talk a little bit about those questions, language needs, and functional limitations. And because we know that our community partners work with vulnerable, hard-to-reach populations, we understand that it's very critical that we, again, acknowledge that you truly are frontline data collectors. Of course, without data, we couldn't identify and address any health disparities. So we'll be talking a little bit more about what we mean when we talk about health disparities and what we'll do with this data. So what is REALD exactly? So again, the acronym of REALD stands for Race, Ethnicity, Language, and Disability. Remember earlier I mentioned that all of our community partners would be required to take a quiz. So I just want to highlight that this may be on the quiz. So please be familiar with what this means exactly. The next piece really has to do with what are those questions. So specifically, I want to point out that these are really a set of standardized questions that collect information on race, ethnicity, language, and disability. So what we'll do is we'll be collecting data at a population level. So we're not really looking at individual level. We're less concerned with the individual level information, which is why we will talk about how eligibility isn't affected. So I know I didn't mention that earlier, but again, do want to emphasize that eligibility is not affected as we walk clients through REALD. So please make sure to be aware of that. I know that many times people can panic about this. So again, just want to highlight for those of you who are feeling a little nervous about our quiz, we will be asking about what this acronym stands for and why it's important. Remember that language, when collecting any information about language, impacts OHP application member communication. So this really just has to do with making sure we understand what languages our OHP members speak. Next, the reason REALD is so important is because we're really utilizing it as a tool for uncovering health disparities among diverse populations and subpopulations. So for those of you who are wondering, what is a health disparity? What does this really mean? I think the best way we can really put that out there is that these are truly avoidable differences in health outcomes. So with that, we wanted to provide a visual and a little video. But before I move on, I want to just make sure we give ourselves a moment to add anything else. Jessica, do you have anything to add?
I'm just going to open that up. Not sharing that right now.
Okay, so just bear with us here. We're going to pull up our video. Thank you everyone for being so patient. We're just pulling up our video here and it looks like it's stuck on our screen. Oh, there we go. All right, we're gonna just back out here because it looks like you guys cannot hear our beautiful video here, but we're gonna go ahead and fix that. So just bear with us and thank you for being so patient. All right.
To better understand the goal of health equity, you need to learn what causes health differences among groups of people. Health inequities are differences in health that are avoidable, unfair, and unjust. Social, economic, and environmental conditions can affect health in a number of ways, creating health inequities. Social inequities occur when a person is treated unfairly because of things like race, class, gender, sexual orientation, or immigration status. Institutions, such as corporations or schools, have the power to create unequal opportunities based on social status. These unequal opportunities can lead to poor educational outcomes or fewer job opportunities, creating economic disadvantage. For example, a college graduate earns over $36,000 more per year than someone who did not finish high school. Income can determine the neighborhood you live in. The environmental conditions of a neighborhood can affect a person's health. In Marin, California, someone can live 15 years longer than someone who lives just 8 miles away. Why? Lower income neighborhoods tend to be in poor social and environmental conditions. Examples include being closer to environmental hazards, such as freeways or power plants, having higher crime or violence rates, or limited access to healthy foods and safe places to exercise. Social, economic, and environmental conditions can affect health disparities, which are differences in health among groups of people. Health behaviors affect disparities. If people are not educated on how to lead a healthy lifestyle, or they lack social and financial support to make healthy choices, they may choose certain behaviors over others. Behaviors such as smoking, poor nutrition, or unsafe sexual behaviors increase chances of developing chronic conditions or diseases, which can affect how long someone lives. Smokers live at least 10 years less than non-smokers. Health disparities are also affected by genetics. We are learning more every day about how our genetic makeup makes us more vulnerable to certain health problems. Access to quality healthcare is one key in reducing inequities and disparities, but health is more than just disease or illness. Health is how we treat others, the opportunities we are given, where we live, and our everyday behaviors. Nobody should be denied the chance to live a long, healthy life because of social, economic, or environmental conditions. To achieve health equity, we need to eliminate avoidable health inequities and health disparities. We need to create fair opportunities for health, provide equal access to resources, and invest in low-income neighborhoods. Health equity will be achieved when everyone is able to reach their full health potential.
To learn more, visit our website at healthequity.sfsu.edu.
All right, everyone, so we're just exiting out of our video and getting back to our slides. And so everyone should be able to, at this point, see that we are back to connecting REALD to health disparities and health equity screen. So, you know, given that we've had an opportunity to just get a little example of what is health equity, this is a good opportunity to think of examples and reflect on some of the health disparities you as community partners have run across. So think about, you know, how do they arise? How do we identify them and how we address them? If you look over to the far right of the screen, you'll notice our schematic or image, visual image of what we intend to do with REALD. So the first step is to collect this important information through our critical community partners as they walk clients through the application. The second step is to identify potential disparities given the information that we collect. And the third is to develop population-specific interventions. After that, what we would do is really look at those interventions, and this really gives us an opportunity to evaluate the progress. Did those interventions work? And then last but not least, we would hopefully, you know, address those disparities and really advance health equity. And of course, if we find that our system or processes are not working, it would give us an opportunity to really go back to the drawing board and kind of come together with new solutions. All right, so the big picture, where did this all come from? Notice our timeline in front of you. So definitely want to take away that what we want to highlight is REALD standards didn't surface overnight. So they didn't come out, you know, out of thin air or anything like that. But really this movement started in 2000. So in the year 2000, our Oregon governor identified that REALD is critical to Oregon. And then in 2011, Department of Health and Human Services established these data standards for race, ethnicity, primary language, and disability status. In 2013, I'd like to highlight that leadership and key partners helped sign Health Bill 2134 into law. And as you can see with that, our RAC committee developed REALD standards, eventually leading to funding for implementation, hiring the right staff, and making sure our one system was REALD compliant. So how does this really relate in our state? Some additional context to Oregon. So again, want to remind everybody that this is really a community-driven initiative. This is why our community partners are so important. As I mentioned earlier, we've partnered with key local community advocates who called for specific data standards. And because of that, it's been very important to OHA and DHS to ensure that these, you know, truly are standard, in addition to representing our diverse communities. Next, we want to make sure we remind all of our partners that the questions are validated. So what do we mean when we say validated? What we mean is that, again, that these questions didn't come out of thin air. You know, we've had a number of people doing a lot of work to get all these questions standardized and thinking of different ways to get the message out. Questions have been tested. There's been listening sessions and public testimony. Some of you may or may not be familiar to what that process looks like. So just want to remind you that it is quite the process, and again, a lot of work has come to together to come to this place. So thank you for all of you who have been a part of that. So thanks to all that work, and because of you, we now have our REALD questions in one. So those are available in the applicant portal and worker portal. They will be ready on our paper application PDF form. Hopefully, I think actually we're pretty close to that. So right now we have fall 2017, no exact date. I apologize for that, but more to come on that. All right, so moving on to finding updated REALD questions in one. So where do we find these questions exactly? Most of you who have been assisting already know, but we do want to highlight this for those of you who have not had a chance to utilize the one system. So please do note that there are 16 questions total, 3 of which are related to race and ethnicity, 6 related to language, and 7 related to disability. Everybody on the application this time is addressing these or answering these questions. And we know that our community partners have quite a bit of feedback as to where to move the questions or how to rephrase them, and definitely have continued to compile a list of that input. Unfortunately, at this time, the questions cannot be changed, but we are definitely, like I said earlier, keeping track of those questions. So if you think of anything new, don't hesitate to reach out to your ROC and we can add that to our wish list. Earlier we talked about how these questions do not affect eligibility. It's very, very critical that we remember that. Many times clients panic as you start to, really probe and ask these questions. They do, they are very personal, and so it's very critical that we remember that REALD responses do not affect eligibility. And again, I know we're going to be taking a quiz after our training today, so we may or may not ask if the REALD questions affect eligibility, hint, hint. So please be sure that you highlight sentence in red. And next, what we're going to do is go ahead and work through what these REALD questions in one look like. We're really going to get into a deep dive, but first what I want to do is just kind of highlight the functionality in the one system. So don't panic if I don't answer everything on this one slide. It really is about kind of setting the stage for what the questions will look like. What I want to highlight here is that the arrows, if you click on those arrows, you will have an opportunity to view subcategories. So notice under the open-ended question, how does the individual identify their race, ethnicity, tribal affiliation, country of origin, or ancestry? You'll notice that if you kind of scroll down to the bottom, you have those downward arrows. Please make sure that you click on those in the one system to collect data on subcategories. So note that those categories also include other and unknown. And notice that clients can also decline to answer. So just be aware it's an option, but overall it's super, super critical to answer the questions, to make sure clients answer the questions if possible. So very much critical that clients have an opportunity to answer those questions on their own and self-identify. If more than one subcategory is selected, so if you scroll to the very bottom, you'll notice it says, please select the identity that best represents your racial or ethnic identity. Note that if more than one subcategory is selected, select primary identity. So it's really important that you click that drop-down menu so that we can collect the most accurate information. All right, so moving on to language proficiency. This has been kind of one of the hot topic questions in our collaboratives across the state in the last few months. How well do you speak English? So this question is below the race and ethnicity questions in the Build Your Household section of the application. I just want to highlight where that's at. So please do be aware of that. And again, we'll deep dive a little bit more into that question here in just a moment. Moving on to REALD questions in one. So this has to do with disability. Really the key takeaway here is that anybody who answers yes to any of the first 6 questions, know that you will get a follow-up question. So the follow-up question is, at what age did the condition begin? And you can see that here. So notice that example. So the next slide you should see in front of you, REALD questions in 1. Let's see here. So please note that these questions are located in how would you like us to reach you section under address information. All right, so next we're going to move into breaking down those REALD questions. I know many of you are really looking forward to getting into the deep dive of things. Before we move on, I want to make sure I check in with Jessica to see if there's anything we missed. But just bear with me here in just a moment.
Hello. I think we're good. I just want to remind everyone that we are taking questions, but that we won't be answering them until the end of the module as far as what we'll be speaking about, but we will be answering some of them via the question box as we go. That's it from me.
All right, thank you everyone. So it sounds like I'm picking up on some feedback noise, so just bear with me here for just okay, so hopefully everyone can hear me all right. For some reason, I'm picking up on some feedback noise. If you're having any, much better, thank you. Not sure what happened there, but for some reason I could hear a lot of, it sounded like a car on my end. So Jessica, I'm gonna check in with you since you're in here with me. Can you hear me okay? On that end, perfect. All right. So breaking down the REALD questions. Thank you everyone for your patience as we back through, go back and forth between mics here. My slides are frozen. Okay, so everyone get excited. We're gonna deep dive here. If you need to do some jumping jacks, feel free to do that to kind of get our blood pumping. But moving on, we have, remember it's really important, I should say, to really write down and highlight some of these notes. I know many of you are going to jump on that quiz afterwards, and so what you want to do and write down, in case you want to be prepared for your quiz, and really, you know, give us a good, solid score so that we feel confident in our partners, and so that you feel confident and that you have all the information. Please do continue to make notes. So one of the notes I'd like you to write down is to remember it's very important to know how to ask REALD questions. So just a little kind of pop quiz here. If you feel awkward asking REALD questions, or if you feel uncomfortable, does it make sense to just not ask the question? The answer here would be, definitely not a good idea. So we may or may not ask that on the quiz. So just something to be aware of. So let's deep dive here. I know I'm getting a little sidetracked with preparing everybody for doing well on our quiz, but I'm sure people probably are really grateful for that, I'm sure. Okay, so question, how does the individual identify their race, ethnicity, tribal affiliation, country of origin, or ancestry? So I'm sure as many of you walk clients through this question, you ask them this. So you're probably wondering why this question. So if you are curious why we ask this question, it is open-ended, and what's important is that, you know, we recognize that people don't like labels, or you know, people have other identities not in the race, ethnicity categories or subcategories. So this is why it's an open-ended question. Truly having this question is a way to honor that and help with data quality, so it makes it much more accurate before getting into categories and subcategories. I want to remind all of you that it's really important that our OHP applicants and members self-report. Application assisters are not to assume or decide. So it wouldn't make sense, to look at me and if I was your client and assume that I speak one language and not the other. So definitely very, very important to allow and encourage clients to self-identify. So the next question on here has to do also with race and ethnicity. So the question is, racial ethnic identity. Select all that apply. To help ensure all members receive quality care, the best services possible, and equal treatment, we are asking all members about their racial and ethnic identity. So why are we asking this question? So remember, we have 35 racial and ethnic categories and subcategories, which include other, don't know, and decline to answer. Make sure that you allow and encourage clients to choose as many subcategories as possible. We ask this question because the collection of granular data is used to really help us identify in detail those health disparities between different racial, ethnic groups and subgroups. So this is a good thing, right? Again, please do encourage OHP applicants and members to self-report and do not assume or decide. Okay, so the next question has to do with making sure we identify. So please select the identity, that best represents your racial or ethnic identity. So if you're choosing more than one subcategory in the previous question, select primary racial ethnic identity from a pull-down menu of the identities they selected. Remember that decline to answer is an option in the pull-down menu, but of course, we only select decline to answer if a client chooses to do so. So always want to encourage clients to complete the questions to the best of their ability. Why are we asking this question? It's helpful to use the individual's primary racial ethnic identity in analysis, of course. And it really takes takes away the need for an analyst to make decisions. For example, creating a multi-option for research and reporting. I'm going to do this a few times, and I already know that by now our partners have it, and they're like, we know, Ruby, we get the point. But just want to remind everyone, OHP applicants need to self-report, self-identify to the best of their ability, and we never want to make assumptions. So we're moving on to language questions, preferences. So the questions are, do you need written materials in alternate format? If yes, which? Do you need an interpreter? Do you need a sign language interpreter? So what's really great with our format is that there's multiple options, those of which are most commonly requested formats by our current OHP members. And these include Braille, oral presentation, computer disc, audio tape. So we have multiple options, and this is a good thing. Options are yes, no, don't know, and decline to answer. Why are these questions important? They really indicate how to best communicate, and it allows or encourages DHS to honor preference and really meet clients where they are, flagging need for an alternate format, interpreter, and type. And it really does allow us to find and address potential health disparities, which is key here, right? So notice we have our reminder again. We want clients to self-report. All right. In what language do you want us to speak with you? In what language do you want us to write to you? The format is a drop-down list of options. It's quite the extensive list, as a matter of fact. And the reasons we ask these questions. So why are we asking these questions? This really has to do with language access. So it gives us an idea of how to best communicate with our clients, and it honors preference, which is really very much critical. And again, it helps us identify and address disparities with non-English speaking groups who are also limited in English proficiency, which tend to disproportionately experience health disparities compared to English speaking groups. System level planning, determining the need for interpreters. So what this really means is that it helps us match members to staff who speak the same language. So for example, recently we've been working with community partners who have been experiencing issues where our clients can't get to a Spanish-speaking call center representative. So this then would be an opportunity to really uncover those health disparities and create more opportunities for our local communities, right? So just some friendly reminders, again, OHP applicants should self-report, and it's very critical that we acknowledge that preferred spoken and written language may be different. Okay, so let me advance to this next slide here. Looks like I'm frozen again. Okay, thank you, Jessica. So our next section has to do with language questions and English proficiency. So how well do you speak English? This again has been kind of one of the hot topics amongst our community partner collaborative meetings. And the format here that you will see in the one system is going to be a long list of drop-down options. So this will be very well, not at all, unknown, and declined to answer. So why are we asking this question exactly? This really helps us identify those with limited English proficiency, and it really does close connection to health disparities. In addition, it helps focus on interpretation and translation needs for those with limited English proficiency, and it identifies top languages of need. In addition, it really does support system level planning. So for example, determining the need for interpreters and matching members to staff who speak the same language. We talked about that earlier, right? Disability questions. To ensure that all members receive quality care, the best services possible, and equal treatment, we are asking all members about disability and functional limitations. So the format here that you will notice is 7 questions. Please highlight that this is based on functional limitations, not medical diagnosis. The questions are left neutral, which means that they're not going to contain the word disability. And the reason we're asking these questions is because it really will help identify the prevalence of people with disabilities. It'll give us the opportunity to identify and address potential health disparities. One between people with disabilities and people without, and 2, differences among people with disabilities by functional limitations. And most importantly, just remember this is intended for long-term disabilities. Remember, OHP applicants and members are to self-identify the best of their knowledge, and application assisters are not to assume or decide. Okay, so disability questions are continued. So we will go ahead and continue with this topic because this is very important. Let's start with age individual acquired a functional limitation. So what I want to emphasize about this is we do want to identify disparities from differences in life opportunities. So what this means, anytime we're asking about age, we're really trying to uncover health disparities based on life opportunities and exposures and stressors influenced by when the condition began. Remember, questions are a subjective measure. So individual determines what a serious difficulty means. So for example, we've had partners share different scenarios of what they're running across, and this has been really helpful in kind of preparing for potential questions. But let me just share a little example here. So older people may define serious difficulty differently than younger people. They may see the limitation as part of aging and not a serious limitation. So just a reminder that this is used to collect demographic data regardless of diagnosis, and it has no impact on eligibility. Anytime you have clients panicking about eligibility, remind them that the REALD questions are actually, in fact, not related to eligibility. Very, very critical. So with that, I will go ahead and jump into questions that are not REALD questions, but can be confused as REALD questions. So this would be American Indian Alaska Native information questions. You'll find this under household details, and it appears after tax information. This question does impact eligibility for additional benefits and CCO enrollment options. Another question that is so many times confused as REALD has to do with aging and people with disabilities, also known as APD. So these questions below that you'll notice in front of you typically create referrals to aging and people with disabilities. So they're the questions that have to do with being over 65, where you start your application and build your household. Under the section where we ask about any member in the household who's applying for coverage, and if they're blind or permanently disabled, under household details, receiving Social Security disability income, and does this person need someone's help with things like walking, using the bathroom, bathing, or dressing, or do they reside in a nursing home, hospital, or assisted living facility? This does not include children who only need help because of their age. So we had a wonderful partner point that out. We have clients sometimes who are concerned about that we are not talking about children who need help because of their age. Not addressing the little munchkins in this question. We also have receiving supplemental security income, so SSI health coverage details. That could potentially trigger a referral to APD. And then if a client does share that they're enrolled in TPL or Medicare, so those health coverage details could potentially refer the case to APD and are not related to REALD. Okay, so something that's really important that I think at this point our partners understand, because you're all professionals and we know how hard you work, is that it's critical to ask the REALD questions, right? So remember, applicants do not have to answer, but it is encouraged to encourage our clients to answer the questions. Remember that as a sister, you cannot change the wording of any of the questions unless you're meeting accessibility language needs. So you can do this by getting to the heart of the question or by restating key words. This doesn't necessarily mean, I guess what I should do is read a question and restate it is the best way I can put it. I don't want to tell you what not to do because that makes it much more confusing. So maybe somebody, for example, you ask them if they're blind or if they need, or if there's an individual that has a serious difficulty seeing even when wearing glasses. So what you could do is restate keywords. So even when you're wearing glasses, for example, that would just be a different way to make sure that we're not changing the wording of the questions, but we're helping folks understand the questions. Is really just kind of circling back and restating the question, or keywords is what I should say. Next, application assister requirements. So this really has to do with allowing applicants to self-report. So never assume, please do not judge without asking, obviously. You know, we're definitely going to assume best intentions, that our partners aren't judging without asking, but we want to remind folks that it's really important that we do not judge and instead make sure that clients self-report. Encourage individuals to answer to the best of their ability, so they just, you know, do the best they can do, and remind that answers do not impact eligibility. So this will really help us get as many Oregonians enrolled and getting through the application in the most seamless way. Okay, so How are we doing on time, Jessica?
Almost an hour in.
All right, so it looks like we're doing pretty good here. I do want to go ahead and make sure we touch on English proficiency question. So even if you're communicating in English, it doesn't mean that the applicant member identifies as having a strong English proficiency. So, you know, for example, I'll go ahead and share that my mom speaks primarily Spanish, but does speak some English. That said, she would prefer to have someone walk her through an OHP application in Spanish. So it's really important that even if someone is communicating to you in English, that we don't assume that that's their primary language or that that's their language of preference. So again, you know, along with all REALD questions, it's important to ask, not assume. So for example, how well do you speak English? And we have a member say, well, we are speaking English now. Doesn't that tell you how well I speak English? I wouldn't be surprised if you run into a few clients that respond this way. So one way to, you know, kind of handle that is to let your client know that you cannot make any assumptions. So I can't make any assumptions. I need to know if you say you speak English very well. What would you like me to put down? You know, definitely want to make sure we let them answer the question. All right, so moving on to disability questions. So when to really dig, when to probe. If you have an OHP applicant member who is unsure how to answer, you should ask them if the condition causes serious difficulty. So this is just a tip and trick if you run across this issue. So for example, we have Monica Juarez, who's our wonderful community partner, and she asks her client, Jessica, because of a physical, mental, or emotional condition, does your son have a serious difficulty concentrating, remembering, or making decisions? And Jessica would answer, well, my son has ADD. And then Monica would reply, does that cause him to have serious difficulty concentrating, remembering, or making decisions? If Jessica is uncertain, she would mark, don't know. And if she's certain, of course, she would answer the question, however she identifies. All right, so disability questions, when to probe continued. If there's confusion or misunderstanding, so for example, because of a physical, mental, or emotional condition, does anyone have serious difficulty concentrating, remembering, understanding, or making decisions? And then member responds, my mother is old and forgets to take her medication sometimes. Application assister would say, would you say that your mother has serious difficulty concentrating, remembering, understanding, or making decisions? So this would be a really good way to make sure that we're kind of probing rather than completely rephrasing a question or even slightly rephrasing a question. It reduces confusion and hopefully can smooth things out. All right, now that we've talked a little bit about probing, we definitely want to make sure we address questions and concerns. So we wanted to share some of the questions and concerns that our wonderful OHP applicants have shared with our community partners. Just as a tip, so for example, I have pre-existing conditions. Will that keep me from getting coverage? What you would want to say is no, OHP does not base eligibility for coverage on a person's health. How should I answer this question? I cannot tell you how to answer this question. You should answer with the response that you are most comfortable, you choose. If you are uncomfortable answering the question, you may decline to answer. If you do not know, you can select unknown or unknown/I don't know. So another example is in front of us here. Why are there so many questions? I don't want to apply because of all these questions. So what we could say as community partners or enrollment assisters is OHP wants to make sure all members receive the best service. So we want to make sure you receive the best service. And these questions help us find and address gaps in social services and health. Do you want to provide this information? You can always choose to decline to answer. So obviously we start by encouraging the client to answer the question, and then we offer to decline if that's what the client wants to do. Will my answers affect my ability to get OHP? No, answers to these questions do not change your ability or others' ability to get OHP. That's a good thing. In addition to hearing from our wonderful OHP members, we've also heard directly from our certified application assisters across the state. So we've compiled quite a few questions. Jessica, do you think we'll have time to go through most of them, or should we just go through half? Yeah? All right, so because we're doing well on time, I'll go ahead and go through them. So what do you mean by physical, mental, or emotional condition or problem? Does the person need to have seen a doctor about it? So what we want you to know is the answer is no. These questions are only so we know if a person has a functional limitation. The person may have serious difficulty doing something. However, it does not mean that they have had a diagnosis. So if this person is worried about this, suggest they talk with their doctor. How do I get people to talk about these sensitive topics? So we've had partners who may feel uncomfortable and they're just needing a little extra support. And here is some advice. And of course, if all you other community partners out there have better advice, we're happy to hear it. You can email this to OHP Outreach, and we can go ahead and run it through our team and see if it's something we can add to our list. So again, how do I get people to talk about these sensitive topics? Let them know everyone has the same questions, right? It's not that we're isolating someone. These questions are being asked across the state. Asking these questions is new, and over time it will become routine. Let them know this data helps us identify social service and health gaps, and that it does not affect eligibility to help OHP benefits. Clients can always decline to answer, and collecting this information will help us at DHS ensure that all OHP members receive the best level of service. Okay, so additional questions and concerns. Can I just skip the REALD questions since you don't receive OHP members, since you don't require OHP members and applicants to answer them? So we require you to ask all the questions, please, and OHP members and applicants can always select decline to answer. How much can we reframe or rephrase if OHP members or applicants do not understand what we are asking? It is super important that enrollment assisters ask the questions as stated. You can repeat them, you can use keywords, you can use probing questions if the person needs clarification. However, you cannot reframe or rephrase the question. This is to keep data collection standards. So very critical that we ask questions based on what you see in front of you. I've struggled with how to get OHP applicants and members to just respond to the questions and not detail their entire medical history with me. How should I handle this? Oh goodness, I'm sure that all 100 community partners who are logged into this webinar run across this every day. You know, our clients want assistance with all sorts of things, and our partners do wonderful work, and so cutting them off, you know, can feel rude, and what we want to do is make sure that we give you some guidance. So try to redirect the conversation back to the questions. Remind the OHP applicant, remember that the OHP application is lengthy. You can even set the stage at the beginning of the appointment to let them know, you know, that the application is lengthy and that you're going to do your best to get them through it. For example, you know, during their appointment time. So that might be an hour and a half. Depends on what your schedule looks like, of course. And remind the OHP applicant there's a requirement for you to ask a subset of 15 questions regarding their identity, so you can really set the stage. These questions do not affect their eligibility for OHP. We've talked about that a few times. And remind them that OHP has you as a community partner ask these questions in order to ensure all members receive the best level of service. We know it can get personal and emotional at times. Many of our community partners are building relationships with clients, and as a matter of fact, we have partners out there who have long-term clients, who have known clients for several years. And so these questions can really be a trigger for some people. So thank you so much for your patience as you walk clients through these very important questions. So how to handle these emotional responses? Obviously, we do our best, but definitely acknowledging feelings and experiences, but also focusing on what is happening here and now. We can also shift to factual questions or take a break. Another question from our applications assisters, so I believe these are actually the last two we have for today. If we ask them if they need an interpreter, OHP members and applicants may assume we will provide one. As an OHA certified application assister, I must arrange interpreter services for you or connect. I think there might be a typo here. Maybe I'm reading this too fast. Or connect you to a source that can provide interpreter services, such as OHP. So in a nutshell, you can make these arrangements one way or another. If you need an interpreter, it is a good idea to contact with your provider and your coordinated care organization to make sure they know that you do. Sorry about that. That was a little wordy for me. Kind of a mouthful. Okay, so these questions do seem repetitive. It's confusing that you ask some disability questions twice. This is some of the feedback we've received from our partners. And thank you, obviously, because it really gives us a little insight on what other partners are experiencing. So the two disability questions in the application section are for use in determining eligibility. They do not identify people with disabilities as a group. Not all people with a disability qualify for OHP, so it's something to be aware of. All right, so that's it for the list of questions we've received from community partners across the state. We've kind of tried to identify patterns of questions we're getting. But if you can think of any outside of our slideshow today, please feel free to email those to our community partner outreach inbox. I do want to note additional supports. So we've developed a comprehensive frequently asked question handout, which includes all the common questions we've received from our applicants, our OHP members, and from our application sisters. We can continue to add to this, of course, if there's something missing or we're identifying patterns of questions. So we will follow up, I believe, with that handout, and it will also be available on group site for you to download. We're also working with our lovely partner, Office of Equity and Inclusion, who's currently developing a brochure. So that will really help us get the message out, the word out. And worksheets will be available on group site soon, so more to come on that. All right, everyone. Well, thank you. That concludes the first section of the training today. So you have now, congratulations, completed the REALD training module. And, we will take a break here in just a moment and come back to our renewals section, which Jessica will be presenting today. So we're going to go ahead and, take maybe a ten-minute break. Yeah, we'll go ahead and do a 10-minute break. So make sure you stay with us and come back. You do have to complete the next section of the training so that you have answers for the quiz and can continue to either maintain your certification or complete your certification. So please do join us in 10 minutes. So we'll be back, let's say 2:15. All right, thank you, everyone.
So welcome to your next module, which is Renewing in One Applicant Portal. First off, we're going to talk briefly. Oops, let me get to the correct slide. Here we go. First, we're just going to talk very briefly about the 3 different ways that you can help people renew. So we're going to be focusing mostly on renewing in Applicant Portal, which is one of the ways that people can renew. You can either be logged in as yourself as a community partner and help with anyone that you are linked with. So that's any case that your organization has helped in the past or that you have recently submitted a current consent form for. You can also help people set up their own accounts or use their own accounts to complete a renewal. If you are not linked to someone, if you have not helped them recently in the past and you can't find them in your search, then you can always submit a consent form to ohp.outreach@dhsoha.state.or.us. In addition to the One Applicant portal, you can also use paper. So people will get paper renewal forms sent to them in the mail, and that will go out to the primary applicant on each case when they're up for renewal. Part 1 can be signed and submitted on its own if there are no changes for that household to report. If there are changes involved, then you will need to download and fill out Part 2 of the renewal form, and that's in addition to the Part 1 that was mailed to people. If someone has lost their paperwork, you can always download a blank Part 2 renewal form. It can be a standalone form as long as you fill it out completely and it has enough information. Part 2 can be found online on our public-facing website, and we've also put up a current version of Part 2 onto our group site. So you can also find it there. It is possible to submit a new full application to process a renewal. However, we don't recommend that because that may not keep people's benefits on while it is in processing. If someone's benefits have already lapsed, then they will need to submit a full application as opposed to the renewal paperwork. So we've talked about the One Applicant portal, we've talked about paper. People can also call customer service to process a renewal if they have to. We don't recommend that unless maybe there's a very urgent case or there are language or other accessibility issues that make a paper or online format not possible. So those are the 3 ways that people can renew, and those are all 3 ways that you can help people renew as well. Now we're going to focus in specifically on applicant portal. Step 1, for those of you who are already in One Applicant portal, you've probably already been through this, but you need to make sure that your computer can support our One Online portal. And so there are specific browsers that are supported, and there are specific types of those browsers. So for instance, maybe the newest version of Chrome might not be on this list, but we will update it as we continue to test the functionality of One. If you don't know your browser version, you can always click the Help menu and click About. And you can always talk to your IT department for more details if you're not sure if your browser can support One, or if you're experiencing any issues in One, browser is a great place to start. Here's another warning that's mainly for people who are new, because if you've already been invited and you already have an account, then you should be good to go up through these steps. But if you're not already set up with your own CP admin account, you have to wait for an invitation. If more than 2 weeks have passed since you got your Assister ID and you haven't received an invitation, that's a great time to contact CP Business. Those invitations come from this email that you see here, one.admin@dhsoha.state.or.us. And we do also have a step-by-step instruction set and a handy YouTube video that's on group site to help you create your One account. Okay, so at this point you have an account, you're all set up, you know that your computer can handle our One Applicant portal, you'll get to our sign-in, which many of you are probably pretty familiar with. Click Accept. A quick note that every single time you log in, you will get a one-time password that is emailed to your work email. This code expires 10 minutes after it is sent to you, so you may need to click that resend access code if you start logging in and then maybe get sidetracked in a conversation with a client or something else comes up. Make sure you only click that resend access code once. If you click it multiple times, you might get multiple access codes, and each one will sort of nullify the one that came before it. So that's something that I know has come up. If you get some sort of message that tells you to contact your outreach coordinator, this sometimes pops up right on this screen. Just know that the correct place to contact someone is at our CP line, which is 1-888 865-0525. All right, we've fully logged in, and now we are at our dashboard. We are not going to go into all the details of your dashboard, but we do want to immediately go down to the bottom of it and look at that search for your customers section, the search section. That's very important and is the first step to starting a renewal in one. So I'm going to show you very quickly. On the top, you'll see what are the default settings for that search. And then we've shown you at the bottom what the optimized search settings are when you are looking for renewals. I especially want to point out that, so when you're looking for renewals, you need to search by primary applicant. And the submitted date, the best way for a renewal is to click all time, because you may not be sure when that application was originally submitted. The default setting is 1 month, and I can guarantee you that a majority of renewals, they won't have just gone into the system 1 month ago. So make sure that those two things are switched away from the default settings. The last one we want to point out, and that is the default setting, which is not selecting a specific assister. If you know for sure that you're the one who helped someone out in the past, you can try searching by your name, but we want to make those search fields as broad as possible so that you can find someone, as opposed to trying to narrow it down and maybe missing them. So you want to not click any specific assister in that assisted by section. Second. All right. So after you have clicked search, you will see a list of names. And those are all clients in all cases who your organization has helped and who fall into whatever those search results you've done. We want to take a moment to troubleshoot some things that we think might come up at this point for you, which is, what if a client isn't on your dashboard? First, we want to ask, have you tried searching using different criteria, different parameters? So maybe there's a typo in the name when it went into the one system. Maybe you're 1 digit off for the case number. There's a lot of different things that either can make it harder to find people, but they're still reachable. I would say those search issues, just keep trying a few different things, and if they still don't pop up, then maybe they aren't on your dashboard at all. And so instead of a search issue, I'd characterize that as more of a connection issue. So if you're not linked to a case or an individual, you may need to get a consent form in. Another thing is that if someone does not have active OHP benefits, they will not show up on your dashboard. So in order to renew, and especially in order to renew on one, you'll need people who have active OHP benefits. If they don't have active benefits, they've already lapsed, that's when you need to go through the process to do a new application rather than a renewal. Did you help this client or this household in the past? If your organization did not, then you likely don't have a consent form in with us. So you'll need to do that in order to get linked up. And here we have some more information about consent forms. If you send a signed consent form, a completely filled out consent form to ohp.outreach@dhsoha.state.or.us, we can get you linked up to any current cases. And you can call our CP line, that's 888-865-0525, if you need to get linked up right away. Otherwise, within 1 to 3 days, that will happen if you send it into our ohp.outreach email. So as I mentioned, in order to be linked, we do need at least one person on the case to have active benefits. And so here are just a few examples of why you might not be able to find the client on your dashboard. We're going to talk a little about consent forms next. Here you see an example of a blank consent form. We have this little box around the phrase protected health information because that is key. We have some older versions of the consent form. They don't have this phrase. And if your consent form does not have this phrase, we suggest that if you have any printouts of that, recycle them right away. If that's the electronic copy you have, you can get a newer one on GroupSite. Protected health information is a phrase that's very important in order to be sufficient for using the one system. And I believe any of them that have been coming out in the past year or so, they all have this phrase. This phrase is also important for the Spanish consent form. So here's an example of what that language looks like with Mi información de salud protegida, which is the Spanish version of my protected health information. And so this is just showing you both an English and Spanish version of what that current up-to-date consent form should look like. And here's an example of the revision 4-16 for the Spanish one that I believe is the first Spanish consent form that had the correct language and current language. So now we're going to talk a little bit about common errors that we've seen over with processing when it comes to consent forms. Sometimes we see them where entire fields are missing. All of the fields are necessary, so you need to fill out all of the fields with your client. Sometimes we've seen organizations or even assister names that are submitted as acronyms or initials. We have a lot of different people working on these applications, and not all of them are fully familiar with every single community partner organization. And in fact, many community partner organizations may have the exact same acronym as one another. So it is very important to spell out your entire organization name, your entire name, and also to always include your assister ID. So all three of those things are necessary. If you only include the client's name but none of the other information, that may not be sufficient either. We talked about old versions of the consent form. Just make sure you're using one that has that protected health information phrase included in it. Another thing that can happen is, let's say you send in a consent form, it's fully filled out, but it's handwritten and it's a little hard to read. It can be really helpful when you send that email in to also include in the body of that email some identifiers. Make sure that your name and organization are listed, maybe in the signature or just somewhere in the body of that email. If you have a case number, a prime number, or a social security number for the client, those are all excellent ways that we can find those people and make sure that they're connected and that we have the right client in addition to having the right assister. Here is an example of a consent form, and maybe people can really quickly type into the question box if they see anything that maybe might not be correct about this. I'll give it a quick half minute for you to look it over, and then we'll go over some of the things that might be wrong with this one. All right, people are making excellent points. There are some blank sections here. So the assister ID is missing. It's unclear whether there are any other people on this application. There's no total number of household members. It should at least be one because we know we have our primary applicant here. We also have the applicant's address listed instead of the community partner's address listed. So we just wanted to give you an example of what a consent form looks like and what one that maybe is not correct looks like. Go on to another example, and this example has been filled out correctly. So you'll see that all the fields are filled, it's readable, there are no acronyms, it is dated, and it has a signature. The signature is, of course, very important because without that signature, that person is not technically giving you consent to help them. I will add really quickly that the only section that you don't have to fill out is at the very bottom, which says that this authorization is valid for 1 year from the date unless otherwise specified. So if you leave it blank, then it is valid for 1 year. So that one is the one that I would say is okay to leave blank. One last note on consent forms. We have a handy Word version of the consent form that you can type out the name of your organization, your name, your address, things like that. You could type out your information and then print out a bunch of copies and have those on your desk so that clients only have to fill out their information. Or you can work with a client to type out all of this, everything except for that signature could be typed out. So we hope that this is a useful tool for you. Because it's typed, the likelihood that people will have trouble reading the consent form when we're processing, that's way down. So we do definitely recommend this as an option for you. And when I send you the slides to this, you'll have links, these two English and Spanish link to the group site file, which is where we're storing these in both English and Spanish. All right, now that we've talked about consent forms for a little bit, we'll get back into renewals, the meat of this module. So if you remember correctly, before we started talking about linking up with people and consent forms, we were looking at this screen here, which is once you've done your search and you see people's names. So step one for renewal is you're going to click on that person's name, that client, that case that you believe is in renewal mode. When you click on their name, you'll be sent to a page that looks like this, which has the household member information. And if someone is in renewal mode and they're the primary applicant, you should see this Take Action button here. The Take Action button is key for renewing in one, and there might be a few reasons why the Take Action button is missing. If they're not the primary applicant, if they're not in renewal mode, if you're not sure whether someone should have a Take Action button or not, that's a great time to involve processing staff to double check. All right. The next section, if you click that Take Action, you'll be taken to a page that says Renewal Selection. And it will pop up a list of the household members who are in renewal mode. And you'll need to check those boxes for everyone who needs to renew. If someone is no longer a part of the household, or if they're not going to be renewing benefits, what you do is you don't check the box for that person's name. What'll pop up next is a confirmation asking the primary applicant to digitally sign that a household member has chosen not to renew their Medicaid. They need to select that either that person is no longer in the household or that they no longer want to apply for health insurance coverage through the One system. This is another thing. You need to have the primary applicant there in person with you for this digital signature. You can type it in, but they have to be present. Once you've authorized that and selected Next, you'll be taken to a page that looks a lot like the page in a new application, where you have to authorize OHA and DHS, I suppose now, to access state and federal databases for renewals for up to 5 years. Once again, people can choose any number. If people do not have a specific number of years they prefer, I suggest keeping it at 5. But people will still have to interact with the system and renew every year, regardless of how many years they put into this section. You'll be taken next to a review screen, which looks a lot like the review screen that shows up after you've filled out an application the first time and are about to submit it. You'll notice that there are little exclamation point warning symbols near some of the sections. And those sections are the ones that are required to review, even if someone has no changes that they need to submit. So if people are not reporting any changes, they do still have to go to those pages and click a banner that says they've reviewed that information and it is correct. If people are making changes, then they'll have to go to the section of the application that includes those changes. So if you want to be sure, you can start at the very beginning and go all the way through and ask people about the information on every page. So we're really quickly just going to go through some slides that show what each of those sections look like when you click that little arrow and you see sort of the more advanced review screen. So you can see some of the answers, so people can look at it without going into the page, and they'll be able to see if that information looks correct or not. You'll notice that some of them have exclamation points, but many of them do not. And I'm going through them quickly because we're going to be revisiting a lot of these. All right. So we've gone through all of them. Now we're back at the top of that review because we want to show you what it looks like to add or remove household members within a renewal. So what you do is you're at that Who is in your household or the Build Your Household section. And you want to click Edit on that first section. Once you've clicked Edit, you'll get to a page that looks a lot like that first page of a new application one, and you'll see a little button that looks a lot like the button when you were originally building a household, which will say Add Member. And that's the way that you add someone in a renewal, just like in a new application. If you need to remove someone, you'll see a link that says remove member. The only difference between this and a new application is that it will ask you to confirm that you are going to remove all of the information about that household member. And that goes all the way through the application. So make sure that you really do mean to remove someone before you click and confirm this, because otherwise you'll have to enter in all that information again. And renewals, a lot of this information is pre-populated. Here's an example of what those yellow banners look like at the top of a page that require you to agree that the information on that page is correct. If it's not marked, it won't let you move forward. I do want to point out here that you can see the screen has no button that says, I want to start receiving benefits. If someone is in the household but was not receiving Medicaid from us in the past, you cannot do that in a renewal. You can't add that functionality. Our processing staff can, so you can call it in, you can email ohp.outreach, but you cannot do it from applicant portal, that's from your view, while doing a renewal. So we do want to point that out. You can add or remove members, but you can't add coverage to someone who's already there. And also, this is a good time to point out that whether people were receiving coverage or not, we do need their information if they're part of a household. We're not going to go into what comprises a household because we have other trainings for that. But just remember that a household is not only the people renewing, it's not only the people receiving benefits, it's everyone who has that household or tax status that connects these people together. If someone is not a U.S. citizen, they may be asked to include their information again. So make sure that clients have all of their documents ready, just like they would before starting a new application, before they start a renewal. And this applies to all applicants. I would say income information, citizenship information, the same information you would ask someone to bring to an appointment in which they're setting up OHP benefits for the first time. Ask them to bring that to a renewal appointment as well. You'll see that if we keep clicking next, we'll just keep going through the whole application, even if it's one of those pages that does not require you to mark that the information is still correct. I would say that if you're adding any household members, make sure you do go through the whole application because we won't have any information on that new person. And of course, anytime I call these bobbleheads, you get to a bobblehead page, you have to click on everyone's name. You can't just only get information in this example for Lester, you have to make sure Gail's is correct as well. Tax filing information. I want to make one quick point about tax filing, which is that if someone's status has changed and you correctly put that information in, click next and one does not let you move forward, we have a current workaround where you should put the current tax filing status in as last year's as well. What we really care about is what the status is moving forward. That's the piece of information we're trying to capture here. I'm going to go through a few more slides. They just show the natural progression through a renewal. It's a lot like the new application. Some of them, like prison jail status, do require us to verify that that information is still correct. And other ones don't. Oh, I do want to point out very quickly, because we just did the REALD module, that these slides came from a version of one before the REALD changes came in. So this slide, it does not look up to date. All of this information will be pre-filled. If someone originally did the application before the days of REALD, you'll want to go through those questions with them for the first time as they do their renewal. Household income. Household income is another section that does need to be reviewed. It's also one that is a little bit tricky, so we're going to go a little more in depth into this section. So if someone has job income, make sure that they are marked as having job income. When you click forward, you will see information for a job that may or may not be the person's current job, and the income may or may not match what people now want to report. If you need to make any changes to income, do not click the red X. I know it looks like it's just begging to be clicked. It's bright and red and shiny, but do not click that red X. it only hides that information, doesn't actually remove it. And on Worker Portal and in the summaries of the application, this still shows up. So instead of clicking the red X, we suggest that you click the Edit button. When you click the Edit button, if someone has a job that has changed, this is where you put in either the new employer, the new income, or both. Make sure this information is up to date and edited, but don't click the red X to delete it and add a new one. This is an example of what it looks like if you don't click that banner on the top that says, I agree that all information on this page is correct. It'll say, please complete all the mandatory fields, and you'll have to click that box. Sometimes it might uncheck itself, and I think this happens especially in the income section, since it's the only time you'll have to click Save to continue instead of the next button. Self-employment income works just about the same way as employment income, where if the information has changed, you want to update it, don't click that red X. And another thing you can do here is if someone had self-employment income that ended, you can add an end date in the past, and that will resolve the income. It won't do so maybe right away on that estimated total household income that shows up on the top right-hand corner of one, but it will by the time you get to the end of an application and on the Worker Portal side. Other income works exactly the same way as it would in a new application. Make sure that that information is all up to date as well. No clicking of any red X's. And then expenses. So it's the same sections that were in the original application when it comes to household income. A quick note about the employer information is if someone has changed jobs, it may still list all the information for that old job, and you have to make sure that it's updated to the new job. And if that job in the past has ended and someone does not have another job, say they're unemployed, make sure that you add an end date. There's a section here where you can list a start and end date. And updating the end date on this with an accurate end date is very important for someone who has lost a job. If they have a new job, feel free to just write over with the new information. That's what we need. And we've made it past income, which I think is the trickiest part of a renewal. So it's going to ask all the same questions it asked originally as we continue to click Next. If anyone in the household has become pregnant, it is important to update that information as well. And it's going to ask those same questions about other health coverage, loss of medical coverage, and medical expenses that it did in the original application. People who have continued to have OHP throughout this time should not have any medical bills from the last 3 months that are of things that OHP will cover. So hopefully this answer is no for most people unless they are new household members. Now that we've gone through the application, we'll be taken back to the review page. And you'll notice that it looks a lot like it did before, but all of the little exclamation point warning signs have been removed. And that's one way you can tell you've been through every section that is required. But just because you've removed those warning signs does not mean you've addressed all the changes that someone may want to make. So make sure that you review each of these sections with the client to make sure that it all looks correct. You'll next be taken to a page that looks a lot like that original sign and submit from a new application. People will have to digitally sign and submit. People will be taken right back to that voter registration and veteran information page, those pages that were also in the new application. Make sure that those are correct and click Next. So at this point, one is letting us know that there are some pieces of documentation. There's a request for information. So we may need to verify income, we may need to verify citizenship, things like that. And the one system will let you know what is needed at this point in time. You have those same options that you did for a new application where you can upload those documents right away. You can fax them in, you can mail them in, you can bring them to a DHS office, or you can upload them at a later time. If you choose anything other than I want to upload these right away, you'll be given a warning that lets you know that we do need this information before we can fully process this renewal. If you click next, you'll get to a page that shows what the prior results that people had were, as well as what those new results are. If there are requests for information, if we need that documentation, it'll likely say pending. It may also say approved, and if someone's income has changed, for instance, and they're over income, they might get a denial at this point. So we have rerun eligibility at this point and we're very close to the end of the renewal process. The next page is a CCO choice page, and people can click that yes, they want to keep their current CCO and then continue through. If people are fee for service or open card, if they don't have a CCO and if they do not need a CCO, for instance, if they are Native American and choose to remain open card, then they can click yes. I know it's a little confusing. Keep your current CCO. Their current CCO is no CCO. So yes, we'll honor that and continue forward. If anyone wants to change CCOs and they want to submit a new potential CCO, they can do so by clicking no and then selecting a CCO in their area. You'll get to a page that confirms that your selection has been submitted. That doesn't necessarily mean that people are immediately in a new CCO or anything like that. Have to wait for the paperwork that confirms this. And as a note, if the application has a hard pend in that verification section, it won't be fully authorized, it won't be fully processed until we are able to verify all of the documentation and information that we need. And at the end, you'll be taken back to that client's dashboard. I will point out that many of the dashboards do look like this. It's a little confusing. There's a continue application button. There's a take action button. And there's also a list of the information that we've requested. If you've gone all the way through a renewal, you do not need to select that take action button again. You need to upload documents or send them in if we need those, but we do not need people to take action, and they should not click continue application. And if you do click take action, you'll be taken through the entire application again, so I do not recommend it. As a note, a new application in One saves your information each page, so you can go halfway through, exit out, and come back in. That is not how renewals work in One. A renewal will only update information once that application is all the way through the submission. So if you start a renewal, exit, and go back in, you'll find that it has all the old information from that original application. So that all has to be done in one sitting for it to be processed correctly. What do you do if something goes wrong? We do understand that technical issues do pop up. We suggest that you take a screenshot of the issue, you fill out the one issue template with as much detail as you're able to provide. You can either call our CP line at 888-865-0525, or you can email ohp.outreach@dhsoha.state.or.us to get that ticket process started and to make sure that we record your issue and are working to resolve it. We recommend that you keep your ROC in the loop on your issues and all communications you have. Your ROC can't directly solve your technical issues, but we do want to be involved. We want to advocate for you and make sure that we keep the process moving and keep it going as smoothly as possible. If 2 weeks have passed since you reported your issue and you haven't heard back from anyone, that's a great time to bring your ROC into the situation, and we'll escalate it for you, and we'll work with you on that. The One Applicant Portal Community Partner Issue Template, here's a quick screenshot of what that looks like. You can find it on Group Site. It's in our file cabinet. Your ROCs can also get it to you, so if you're confused about where to find it or what you need, feel free to include us, and we'll make sure you get what you need. We are looking for any One issues to be submitted in this format. So the email subject line should say APCP template. You should have a quick summary of your issue. If this issue is related to a specific application or case, or even an individual client, we would like that information. Please specify if there are urgent client needs or not, the time and date that the issue occurred. The steps, I'd say maybe the 1 to 2 screens beforehand and what you did, so what happened leading up to the issue. If there's any error message or other system message that you think will be useful to us, please include that. Screenshots are hugely important, so if you are able to get a screenshot, that is the best way we can figure out exactly what's going on. And also include what internet browser you're using, your username, phone number, and email address, as well as your community partner name, your ID, and times at which we can reach you if we need to call to follow up. We'd also like your ROC's name, so your Regional Outreach Coordinator. Let's talk about renewing early, which is don't. You can't. If someone's not in renewal mode, you are unable to renew for them. We are unable to process that. While clients are expected to renew each year and should interact with us each year to verify that their information is correct, we can only renew them when they're in renewal mode, which is they've received the renewal paperwork or they were able to call into the state and verify that they are in renewal mode. If you send information in early, it'll be treated as reporting a change. So it is also important for people to report changes within 30 days of those changes happening, such as address, an income change of more than $100, things like that, any household change, so if people left or joined the household. So reporting a change is different from renewals. So you can report a change multiple times throughout the year. It won't count as a renewal. Renewal may still pop up a month later, even if you've just reported a change and done a completely new application with someone. If people's benefits have lapsed, then it is too late to renew, and you'll have to do a new application. The good news is in many of these cases, you'll be able to do that via the one system. Not always, but there's a good chance you'll be able to do that. If benefits have lapsed, then the new application would follow the exact same process as a new application for anyone else. People's benefits would start at the beginning of the month in which you applied, as opposed to in a renewal where the benefits will stay on while we process it. If you want more information, we have a ton of information on ohp.org and .gov. We do have a renewal guide specifically focused on renewing in one. It is a client-focused guide, so it can be a useful tool to give to your clients. And it might be useful to you to see as well, but it won't go into exactly the same details we've done today. That is our renewal module. Thank you so much for joining us, and we'll go ahead and pause for a second. Please feel free to send in additional questions you may have about this module or about the REALD module, or just in general, and we'll answer the ones we can, and we'll save the rest and make sure that we address them. Thank you so much.